Exam tomorrow and ECG still feel confusing? Don't worry. In the next 5 minutes, we'll divide the entire ECG chapter exactly the same way you need for your MBBS Physiology exam. No lengthy textbook explanation, but rather we'll explain this ECG under the following headings: waves, intervals, leads, axis, arrhythmias, blocks, changes in MI, and electrolytes. So stay till the end because the last slide contains 30-second ECG recall sheet that can help you revise the entire chapter just before entering the exam hall. Let's begin with the foundation. Definition. It is defined as graphical recording of the electrical changes that takes place in the heart. Now remember the most important sequence: P wave, QRS complex, and T wave. Now instead of memorizing these definitions separately, remember this story. P wave, atria prepare by depolarizing. QRS, ventricles depolarize and contract, and ventricle repolarize and relax in T wave. And sometimes you may get U wave in case of hypokalemia. If you remember only this sequence, you have already answered one of the most common Viva question. Now let's revise the intervals students most commonly get mixed up. Now focus on 4 high yield components. PR interval. It represents AV nodal delay, important in heart block. QT interval. It represents ventricular cycle, important in arrhythmia risk. ST segment. It represents isoelectric pause, important in ischemia and MI changes. J point. It represents end of QRS and important in marks of ST segment beginning. Now remember these exam clues. ST segment elevation, important in acute myocardial infarction. Long QT interval, hypocalcemia. Short QT interval, hypercalcemia. Now these associations are repeatedly asked in university exams. Students often think leads are difficult, but imagine the heart is an actor and the leads are cameras viewing it from different angles. Remember the 3 standard limb leads. Lead 1 between the right arm and left arm. Lead 2 between the right arm and left leg. And lead 3 between left arm and left leg. Now the examiner's favorite question: why lead 2 is most commonly used? Because it almost runs parallel to the normal direction of the cardiac electrical activity. These leads are not electricity, they are simply different viewpoint of the same heart. Next comes the electrical axis. Don't panic about the angles. Just remember, normal axis lies roughly between -30 and +120 degrees. Right axis deviation, think about right ventricular problem, that is pulmonary hypertension. Left axis deviation, think about left ventricular problem, that is systemic hypertension. Now the arrhythmias and heart blocks. Heart blocks are the conduction delays. It shows 3 degrees. First degree, there is prolonged PR interval. Second degree, type 1, progressive PR lengthening. And in type 2, there are sudden dropped QRS complexes. And third degree, there is complete dissociation between P and QRS complexes. Now about the arrhythmias, the rhythm errors. There are 4 arrhythmias. First one, atrial flutter. It shows sawtooth baseline. Atrial fibrillation shows irregular waves. Ventricular tachycardia shows broad QRS complex. And ventricular fibrillation shows chaotic waveline, no visible QRS complexes. Remember, diagnostic clues for arrhythmias and heart blocks are prolonged PR interval and irregular waves. Now, the clinically most important ECG changes. Myocardial infarction. Acute myocardial infarction can be identified by ST segment elevation and T wave inversion, whereas old MI can be identified by pathological Q waves. For location of this MI, you can refer to this table. Anterior MI can be identified by changes in V1 to V4, inferior by 2-3 AVF, lateral by changes in 1 AVL, V5, V6, and septal can be identified by changes in V1 and V2. Along with this, electrolyte can also dramatically change ECG. You can remember this easy formula. Increased potassium, that is hyperkalemia, causes tented T waves. Hypokalemia causes prominent U wave. And hypercalcemia causes short QT. And hypocalcemia causes long QT intervals. You will remember this even during Viva. Let's revise the entire chapter one last time. We have seen ECG in the form of waves. P wave atrial depolarization, QRS ventricular depolarization, and T wave ventricular repolarization. We have seen intervals PR, QT, and ST segment. We have also seen the leads, lead 1, 2, 3. Single heart, 3 different cameras. Axis deviation, left axis deviation and right axis deviation in left and right ventricular hypertrophy. We have also seen the blocks, 3 degrees, first degree, second degree, and third degree. The arrhythmias, mainly the ventricular arrhythmias in the form of ventricular fibrillation and flutter. Then MI changes, ST segment elevation and T wave inversion. And lastly, the electrolyte changes, mainly the potassium and calcium ions. Whenever you ask to interpret an ECG, always follow these 5 steps. First one, read. See the large squares. Then rhythm, whether it is regular or irregular. Axis, it should be between -30 to +120. Hypertrophy, see the voltage criteria, the height of the QRS complex. And infarction, the ST segment. Revise this slide once before entering the exam hall. If this rapid revision helped you, make sure to watch the complete ECG 10 marks answer video where I explain every concept in detail with the examiner friendly diagrams. And if you want to remember the ECG forever using simple flowchart and visual memory trick, watch the ECG waves made easy memory video link on your screen. All the best for your MBBS exam and keep learning with Physio with Neo.